Good morning, everyone. My name is Divyansh Pandey. I am from Even Christian College, BSc second year Biophysics, and my topic is about generic medicine and IPR. So let's start. So intellectual property rights. Intellectual properties are any intangible, non-physical representation of an idea, such as art, literature, or scientific inventions. In India, there are seven types of intellectual property rights, like trademark, patent, copyright, design, geographical indications, protection of plant variety, information technology, etc. In patents, patents are given to a scientific product, and it comes under the Patent Act 1970, which was later amended in 2005 to comply with World Trade Organization's TRIPS agreement. Now there are two types of patents: patent of product and patent of process. Patent of product is protects the product against infringement. So, for example, if I made this remote, I get protection against infringement. So, without my permission, no one else can manufacture this remote. But if I get patent of process, it means it only protects the manufacturing process. So the process of making this remote is only protected. Anyone can make this remote, but not using the same process as me. Now there are three tests of patentability: novelty, utility, and inventiveness. So what novelty means? So novelty means the product or the invention is something, it should be something new. I cannot patent an old product. For example, I cannot get patent for a light bulb because it was invented before. And uh, inventiveness. So inventiveness means the product must come from the world of science. It means no ordinary man with ordinary skills should able to make it. And it also means the product should not be a work of nature. For example, penicillin. So penicillin comes from nature. So I cannot patent penicillin because it comes from a fungus named Penicillium notatum. But I can patent the process of extracting penicillin, like uh, patent of process. And then there is utility. So whatever I create must have a utility, must have a use, must benefit society in any way. If it does not uh, provide society in any way, then there is no patentability. Now next, we have generic medicines. So generic medicines or all kinds of medicines comes under patent, and patents of process are generally provided to the pharmaceutical companies. Now why we need generic medicines? So we have medicines, branded medicines, so why we need generic medicines? So if a company created, for example, a company created cure for cancer, but if it is so expensive that no one is able to afford, then there is no benefit to the society. And and if there is no benefit to the society and the cure is so expensive, then there is no availability of that product. So that's why Indian government gives manufacturers uh, to create generic medicines. Manufacturing both generic and patented medicine must comply with Drug and Cosmetic Act 1940 and 1945. So benefits of generic medicines are affordability. It is very affordable and cost effective if we compare to their branded counterparts. Now quality control. So Central Drug Standard Control Organization in India monitors both generic and non-generic medicines for their harmful reactions. But in the case of generic medicines, our government have more control over the manufacturing process. Now regulations. So generic medicines are allowed. Indian law allow doctors to prescribe generic medicines and also pharmaceuticals to sell them. So now, for example, if we see branded medicine like paracetamol, it is 1.5 rupees per tablet and their generic version is 0.5 rupees. So there is 3 times less cost. If we see here, this vaccine costs 1,100 rupees per child, but the generic version costs only 400. And here, this is an respiratory disease medicine. It costs 2,600 per patient, but the generic counterpart only costs 200. So we can see it is much cheaper and more available to the society, to the patients. Thank you everyone for listening.